In our last section, we talked about the issues that we can see with some of the collection techniques and the tools that other companies, other data collection sources use to collect their data. And we see some of the critical issues that they can have. Now, understanding those issues that we can have with the tools and the collection techniques that other data sources use segues very nicely into our next section on context and understanding the importance of context of our data. And we all say, yeah, right, that's important, but let's get some, again, a little bit clearer picture on why context becomes so important. Many of the tools that are out there today cannot differentiate references and they cannot maintain context. So this example will show us very nicely why maintaining context is difficult and yet so critical. So if we look here on the left-hand side that we just pulled up, this is an example of a typical chart note or a section of a chart note that a healthcare provider might create for us. And this is a typical what we call objective or more of a physical exam section of a chart note or a medical record. Now, this chart note has actually been structured reasonably well, in fact, very well. We have integument, vascular, neuromusculoskeletal systems, X-ray. This has actually got nice structure to it here under those what we call systems that the physician evaluated. So this is actually a better than average note. Most chart notes are just a few sentences that have just been typed, and they would not give us any of this detail or any of this structure. But there's even with this structure, there are issues that we can run into in maintaining context. So let's take a look over here at the second example and see what it is that might be difficult to ascertain. So for simplicity's sake, we understand reading this chart note would be a bit difficult, but we highlighted these in various colors so that we understand. So there's something under the integument system that, as indicated in green, shows mild improvement. There's some other condition under the musculoskeletal system that showed moderate worsening. But then adding to the difficulty here, there was something else under the musculoskeletal system that showed moderate improvement. And then there's another mention of moderate improvement. So do we have 3 conditions that we're looking at, 4 conditions that we're looking at? It becomes very difficult or very challenging to understand. I've been a private practice physician for 20 years. I am very comfortable reading medical records, but it takes me about 3 read-throughs to determine what this healthcare provider was actually referring to with each one of these assessments on either the improvement or the worsening. And again, I have 20 years of experience, but it took me about 3 read-throughs to determine this. This becomes critical because what this is actually telling us is one of the diagnoses or one of the conditions showed mild improvement, one showed moderate improvement, and as I read through it here, I determined that there was a third condition that showed moderate improvement. So again, mild improvement, moderate worsening, mild improvement. There's no way to ascertain from any type of a data collection system what is the context here. It's very difficult to determine what is improved and what's worse and how much. So this becomes the real issue and the real challenge for any other data collection tool or data collection technique. We must understand context to really appreciate the specifics of the data and to really understand how well your particular pharmaceutical or medical device is really working and how much benefit it's getting to our patients. Any other collection technique would not be able to determine the context of which was better, which was worse, and how much. So therein lies the real issue. We must be able to maintain context so that we can really gain the insight and the data that shows and proves how effective pharmaceutical products or medical device products really are working and benefiting our patients. The Starwriter patented system completely resolves this. An additional key to note in this case is that the provider said that the improvement or worsening was either mild, moderate, or severe. And in clinical practice, that's a very typical way that these things are noted within a medical record or medical chart note. However, for statistical evaluation, this really doesn't give us much information. In the Starwriter patented process, our data is actually collected as a degree or a percentage. It's as a numeric. So the Starwriter data on improvement or worsening is actually collected as a numeric. From the patient's perspective, it's the VAS, pain scale rating, the visual analog scale pain rating. From the physician's perspective, it's on a percentage of improvement. So perhaps it's 20% improvement, 15% worsening, or maybe 85% improvement. Then we convert that into this verbiage in the chart note. But the important critical piece is we collect the data on improvement as a numeric that can be evaluated statistically. Starwriter collects the data on improvement, both the visual analog scale for patient perspective as well as the percentage from the physician perspective. So this is really how we're evaluating the effectiveness of our product based on that numeric that is entered into the Starwriter system. This is a true differentiating factor for the Starwriter patented process.